The kidneys are essential organs that filter waste and excess fluids from the blood, maintaining our overall health. However, various disorders can affect the kidneys, leading to serious complications if left untreated. Understanding the different types and causes of kidney diseases is crucial for developing effective prevention and treatment strategies. The image on this slide provides a detailed illustration of healthy human kidneys, highlighting their important role in our body. I will now discuss the key types of kidney disorders and their impact on our health. The kidneys are bean-shaped organs located on either side of the spine, just below the rib cage. Each kidney is about the size of a human fist and acts as a complex filtration system. The kidneys remove waste, excess water, and other impurities from the bloodstream. The kidney is composed of an outer cortex, an inner medulla, and a central renal pelvis. The cortex contains millions of tiny filtering units called nephrons. The medulla contains the kidney's tubules that collect and concentrate urine. As blood flows through the kidney, the glomeruli filter out waste, excess water, and other substances. These filtered substances are then collected in the tubules. The tubules reabsorb the useful substances back into the bloodstream. The waste products are concentrated and expelled as urine. Kidney disorders can have a variety of underlying causes, including chronic medical conditions, acute injuries, genetic factors, and environmental exposures. Chronic conditions like diabetes, high blood pressure, and glomerulonephritis can damage the kidneys over time, impairing their ability to filter waste and regulate fluid balance. Acute injuries, infections, and certain medications can also lead to sudden kidney damage, potentially causing more chronic issues. Inherited genetic disorders, such as polycystic kidney disease, can cause structural abnormalities in the kidneys, leading to decreased function and the development of cysts. Exposure to toxins, heavy metals, and pollutants can contribute to the development of kidney disorders over time, especially for those living in areas with contaminated water or air. Chronic kidney disease, CKD, is a serious and progressive condition. The kidneys gradually lose their ability to filter waste and excess fluids from the blood. This can lead to a buildup of harmful substances and imbalances of important minerals and nutrients in the body. The image illustrates the kidneys, with the red and blue coloring showing the progression of the disease. It's important to understand the impact CKD can have on the body and the importance of early detection and treatment. Chronic kidney disease is classified into 5 stages based on the level of kidney function, as measured by the glomerular filtration rate, GFR. This staging system helps healthcare providers determine the appropriate treatment and monitor the progression of the disease. I'll briefly go through each stage. Stage 1. Kidney damage with normal or increased GFR. Stage 2. Mild decrease in GFR. Stage 3. Moderate decrease in GFR. Stage 4. Severe decrease in GFR. Stage 5. Kidney failure, dialysis or transplant required. Understanding the stage of CKD is crucial for determining the right treatment approach and managing the disease effectively. Chronic kidney disease, CKD, can progress through different stages, each with its own set of symptoms. In the early stages, symptoms may be subtle, like fatigue, frequent urination, and swelling in the legs or feet. As the disease progresses, more noticeable symptoms appear, such as nausea, loss of appetite, difficulty concentrating, and itchy skin. In the later stages, symptoms become severe, including increased swelling, high blood pressure, anemia, and even confusion or seizures. It's important to note that symptom presentation can vary greatly between individuals, and some may not experience any noticeable symptoms until the disease has progressed significantly. Regular checkups are crucial for early detection and management of CKD. Chronic kidney disease, CKD, is a serious condition that occurs when the kidneys become damaged and can't filter waste and excess fluid from the blood effectively. Doctors use several tests to diagnose CKD and determine its stage. Blood tests to measure creatinine and glomerular filtration rate, GFR. These indicate how well the kidneys are functioning. Urine tests to detect protein, blood, or other substances that may signal kidney damage. Imaging tests like ultrasounds, CT scans, or MRIs to check for structural abnormalities in the kidneys. In some cases, a kidney biopsy may be needed to obtain a tissue sample and determine the underlying cause of the kidney disorder. These tests help doctors diagnose CKD and understand the extent of the kidney damage, which is crucial for developing an appropriate treatment plan. Chronic kidney disease, CKD, has a range of treatment options to manage the condition and slow its progression. Medications play a key role, including ACE inhibitors, ARBs, diuretics, and potassium-binding agents to address underlying conditions and complications. Dietary changes, like limiting protein, sodium, potassium, and phosphorus, can also help manage symptoms and preserve kidney function. Working with a renal dietitian is crucial. When the kidneys can no longer adequately filter waste and fluids, dialysis becomes necessary. This can include hemodialysis, peritoneal dialysis, or a combination. The treatment approach is tailored to the individual patient's needs and preferences. Dialysis is a vital treatment for people with kidney failure, helping to filter waste and excess water from the blood. There are three main types of dialysis procedures: hemodialysis, peritoneal dialysis, and home dialysis. Hemodialysis involves using a machine to filter the blood, drawing it out of the body, filtering it, and then returning it. Peritoneal dialysis uses the lining of the abdomen as a natural filter, infusing a sterile solution that absorbs waste before being drained out. Home dialysis allows patients to perform certain procedures independently or with a caregiver, providing more flexibility in their treatment schedule. Each type of dialysis has its own benefits and considerations, so it's important for patients to work closely with their healthcare team to determine the best approach for their individual needs. Kidney transplantation is a complex surgical procedure where a healthy kidney from a donor is transplanted into a patient with end-stage renal disease. The transplant team works meticulously to ensure a successful operation, utilizing advanced medical equipment and techniques to replace the patient's damaged kidney. After the transplant surgery, the patient requires extensive post-operative care and monitoring, including managing immunosuppressant medications to prevent rejection, monitoring for complications, and providing emotional support during recovery. A successful kidney transplant can significantly improve the patient's quality of life by restoring normal kidney function and reducing the need for dialysis, allowing the patient to return to their daily activities and enjoy a more fulfilling life. Acute kidney injury, or AKI, is a sudden and severe decline in the kidney's ability to filter waste and excess fluids from the blood. Unlike chronic kidney disease, AKI develops rapidly, often within days or weeks. AKI requires prompt medical attention to prevent further damage and complications. The image on the right shows a detailed illustration of the human kidney with AKI, highlighting the inflammation and damage caused by the condition. Acute kidney injury, or AKI, can have several potential causes that we'll explore today. One major cause is reduced blood flow to the kidneys, which can happen in conditions like severe dehydration, heart failure, or shock. This sudden drop in blood flow can lead to AKI. Another cause is direct damage to the delicate structures within the kidneys, which can be triggered by toxins, infections, or physical injuries. This impairs the kidney's ability to filter waste. Blockages in the urinary tract, such as kidney stones, an enlarged prostate, or tumors, can also lead to AKI by causing a backup of urine that damages the kidneys. Certain medications, both prescription and over-the-counter, as well as illicit substances, can be harmful to the kidneys, especially when taken in excess. Understanding these potential causes of AKI is crucial for prevention and early intervention. Reduced urine output is one of the most common symptoms of acute kidney injury, often less than 0.5 milliliters per kilogram per hour. This indicates the kidneys are not functioning properly and unable to filter waste and excess fluid. Fluid retention can occur, leading to swelling in the legs, ankles, and feet. This is due to the kidney's inability to remove excess fluid from the body. Fatigue, lethargy, and general weakness are common symptoms, caused by the buildup of waste products in the blood that the kidneys can't filter out. Confusion, disorientation, and changes in mental status can also occur, as the accumulation of waste products affects the brain. Diagnosing acute kidney injury, AKI, starts with a thorough clinical assessment, including reviewing the patient's medical history, symptoms, and physical exam findings. Lab tests are crucial, measuring serum creatinine, blood urea nitrogen, and checking for protein, blood, or other abnormalities in the urine. Imaging tests like ultrasound or CT scans can evaluate the size, shape, and structure of the kidneys, and identify potential underlying causes like obstruction or tumors. In some cases, a kidney biopsy may be needed to determine the specific type of kidney injury by analyzing a small sample of kidney tissue. The combination of clinical assessment, lab tests, and imaging/biopsy results helps healthcare providers make an accurate diagnosis of AKI and identify the underlying cause. Acute kidney injury, AKI, is a serious condition that requires prompt medical attention and treatment. Patients with AKI often need to be hospitalized so they can receive close monitoring and support to address the underlying cause and prevent complications. Medication management is crucial. Certain medications may need to be adjusted or discontinued to avoid further kidney damage, and diuretics may be used to help manage fluid balance. In severe cases, dialysis may be necessary to remove waste, salt, and excess fluid from the body when the kidneys are unable to function properly. The goal of treatment is to address the underlying cause of the AKI, support the kidneys, and prevent the condition from worsening or leading to long-term kidney damage. Polycystic kidney disease, or PKD, is an inherited disorder where numerous cysts grow within the kidneys. These cysts can gradually enlarge over time, leading to kidney damage and impaired kidney function. There are two main types of PKD: autosomal dominant PKD and autosomal recessive PKD. Autosomal dominant PKD is the more common variety, affecting around 1 in 400 to 1 in 1,000 people globally. The image on this slide shows a detailed illustration of polycystic kidneys, with cysts of varying sizes across the kidneys. Glomerulonephritis is a group of kidney disorders characterized by inflammation and damage to the glomeruli, the tiny filtering units within the kidneys. This condition can lead to impaired kidney function and potentially serious complications if left untreated. There are several types of glomerulonephritis, including IgA nephropathy, membranous glomerulonephritis, and rapidly progressive glomerulonephritis. Glomerulonephritis can be caused by autoimmune disorders, infections, or other underlying health issues. Early diagnosis and proper treatment are crucial to prevent the progression of kidney damage. The image on the right provides a detailed illustration of the glomeruli in the kidney, showing the inflammation and damage caused by this condition. Kidney stones are hard mineral deposits that form inside the kidneys. They can cause significant pain and discomfort, and if left untreated, may lead to serious complications. Factors like dehydration, genetics, obesity, and diet can contribute to kidney stone formation. Kidney stones often cause sudden, severe pain in the back, abdomen, or groin, along with nausea, vomiting, and difficulty urinating. Prompt diagnosis and treatment are crucial to prevent further damage to the kidneys. Urinary tract infections, UTIs, are a common type of bacterial infection that can affect any part of the urinary system, including the bladder, urethra, ureters, and kidneys. These infections can cause discomfort and, if left untreated, can lead to more serious complications. UTIs are typically caused by bacteria, such as E. coli, that enter the urinary tract and multiply. Women are more prone to UTIs due to the shorter length of the urethra, which makes it easier for bacteria to reach the bladder. Symptoms may include a burning sensation during urination, frequent urination, and pelvic pain. It's important to address UTIs promptly to prevent further complications. Diabetes is a major cause of kidney disease, known as diabetic kidney disease or diabetic nephropathy. This condition develops when high blood sugar levels damage the delicate filtration system of the kidneys over time. Maintaining healthy blood sugar levels is crucial to prevent or slow the progression of this disease. Early detection and proper management of diabetes are key to preserving kidney function and reducing the risk of kidney failure. The image on the right shows the effects of diabetic nephropathy, with damaged glomeruli and tubules in the kidney. Hypertension, or high blood pressure, is a major cause of chronic kidney disease. When blood pressure is not well controlled, it can damage the small blood vessels and filters inside the kidneys. This gradual kidney damage can lead to a decline in overall kidney function over time. It's crucial for people with high blood pressure to work closely with their healthcare team to effectively manage their condition. Proper treatment and monitoring can help prevent further kidney damage from occurring. Kidney cancer is a type of malignant tumor that originates in the kidneys, one of the most common urological cancers. It can develop in various forms, with renal cell carcinoma being the most common type, as well as less frequent subtypes like transitional cell carcinoma and Wilms tumor. Early detection and proper treatment are crucial for managing kidney cancer effectively. The slide includes a detailed illustration of the kidney anatomy with a cancerous tumor, which helps visualize the condition. I'll provide an overview of the key facts about kidney cancer, its different forms, and the importance of early detection and treatment. Kidney disorders can have a strong genetic component, meaning they are passed down through families. These inherited conditions can affect the structure and function of the kidneys, leading to complications and potential kidney failure. Some common genetic kidney disorders include polycystic kidney disease, Alport syndrome, Fabry disease, and cystinosa. Understanding the underlying genetic causes is crucial for early diagnosis, proper management, and potential gene-based therapies in the Future. This slide provides an overview of how genetic factors can contribute to certain kidney diseases. Childhood kidney disorders are serious conditions that require specialized care and early intervention. These disorders can significantly impact a child's growth, development, and overall well-being if not properly managed. The image shows a warm, caring atmosphere in a pediatric hospital ward, with colorful medical equipment and doctors examining a young patient. This highlights the importance of providing comprehensive, child-focused care for these complex medical issues. Staying well hydrated by drinking adequate water is important for supporting kidney function and reducing the risk of kidney stones and other kidney disorders. Aim for at least 8 glasses of water per day or more, depending on your activity level and climate. A balanced, nutrient-rich diet low in sodium, added sugars, and unhealthy fats can help maintain healthy kidneys. Focus on whole plant-based foods like fruits, vegetables, whole grains, and lean proteins. Regular physical activity can help manage conditions like diabetes and high blood pressure that can lead to kidney disease. Aim for at least 30 minutes of moderate exercise most days of the week. Chronic stress can take a toll on the body, including the kidneys. Practice stress-reducing techniques like meditation, yoga, deep breathing, or talking to a mental health professional. Early detection of kidney disorders is crucial as it allows for prompt medical intervention, which can significantly improve outcomes and slow disease progression. Regular screening and early diagnosis enable healthcare providers to closely monitor kidney function and implement appropriate treatment plans to manage the condition effectively. By identifying kidney issues early, patients can take steps to adopt healthier lifestyles and manage any underlying conditions, helping to prevent further damage to their kidneys. Early detection is the key to timely intervention, effective monitoring and management, and implementing preventive measures to safeguard kidney health. Regular checkups with your healthcare provider are crucial for early detection and management of kidney disorders. These visits can help identify any underlying conditions and monitor kidney function. Adopting a balanced diet, staying hydrated, exercising regularly, and maintaining a healthy weight can significantly reduce the risk of developing kidney problems. Avoiding excessive alcohol and tobacco use is also important. Closely monitoring and effectively managing conditions like diabetes, high blood pressure, and heart disease can help prevent or slow the progression of kidney disorders. Closely following your treatment plan is essential. Avoiding exposure to environmental toxins, such as heavy metals, certain medications, and chemicals, can help protect your kidneys from damage. Be mindful of what you consume and your surroundings. Modern medical imaging like MRI and CT scans provide detailed, high-resolution images of the kidneys, allowing for earlier and more accurate diagnosis of kidney disorders. These advanced imaging techniques can identify even the slightest changes or abnormalities in the kidneys, which was not possible with older diagnostic methods. This has revolutionized the way kidney diseases are detected and has led to significant improvements in patient outcomes through timely intervention. Healthcare providers can now get a much clearer picture of the kidney's structure and function, enabling them to develop more targeted and effective treatment plans. Kidney disorders can be complex, so it's crucial to provide comprehensive patient education. Take the time to explain the condition, treatment options, and lifestyle changes in clear, easy-to-understand language. Patients and their families can greatly benefit from joining support groups, both in person and online. These communities offer emotional support, practical advice, and a sense of camaraderie during the treatment journey. Equipping patients with self-management tools, such as educational materials, symptom trackers, and medication reminders, empowers them to take an active role in their care. As kidney disorders can evolve, it's important to provide patients with ongoing education and updates on the latest advancements in treatment and management. Kidney disorders are complex medical conditions that require a comprehensive approach to manage effectively. Early detection is crucial, as it allows for timely interventions and better outcomes. Tailored treatment plans are essential, as each individual's needs and circumstances may vary. Preventive measures, such as lifestyle changes and regular checkups, play a vital role in preserving renal health. By understanding the complexities of kidney disorders and the available interventions, individuals can take an active role in managing their condition and improving their overall well-being.